I was at work on a job site and I had just pulled up from lunch. I had kind of gotten a dizzy headache, and then I guess things that I was looking at started disappearing and reappearing. So I knew I had a problem. Symptoms were blurry vision. I had pain in my left arm. My left hand started going numb. I had a hard time walking once I got out of the truck. I was very dizzy and almost disoriented, but I did know what was going on. So symptoms kept getting worse, and in my mind I was going, what's the best way to play this? Where do I go? How do I start? Something just told me. I made the call, thank God I did, to go to Stevens County because of the nature of it and knowing that it's a time thing, that, you know, the quicker you get treatment, the better. One of the things I noticed, how quickly I got attention. The minute we drove up, multiple physicians, nurses, no hassle, nobody asked me questions about my birthday. They immediately took me in and started giving me care.
We've set up a lot of systems that just make this more efficient. Everything comes down from the front desk check-in clerks figuring out that this might be a stroke and alerting our triage nurses, and our triage nurses recognizing it very quickly and calling the code stroke, to us just having a system in place to getting them to get scanned and getting them back and getting the labs drawn and getting the medications ready as soon as possible. Through all that, we're really able to take care of patients well here at our hospital. He was a little bit more complex than your average patient due to his use of blood thinners. And so there was a lot of discussion between myself, our new cardiologist, Dr. Matthews, as well as our telestroke team to figure out the best course of action for him.
The patient has a heart history and it had a valve surgery in the past. Certainly there's a lot of issues around valve disease and stroke. So when I was called, I would try to quickly get some background information and then try to see if I could go help out in the emergency department. And then one of the major issues that came up is whether he's safe to have an MRI. He could get an MRI safely, and then also could he get emergency medication for his stroke. This was a great example where teamwork, makes the difference. Whether it's sepsis, heart attack care, or stroke care, getting all the key players together to work together, patients can have the best outcome,
So the purpose of doing the CT and the MRI as soon as possible is to determine whether the patient had a stroke or a bleed, and then how to treat. We work as quickly and as safely as possible to help the patient.
I felt like I was the only person in the hospital. From the triage nurse to my nurse that actually took over and the doctors, neurologists that came in, it was like I was the only person here. That was a lot of success that we had in the procedure that we did. Everybody was focused on what they were trying to do, made some quick decisions, hard decisions, but quick decisions fast. I think that's the difference. I think that's why I have no symptoms. This thing got gone as quick as it did.
Came together in a very short period of time. It was like, between the emergency doctor, myself, and the neurologist, we had to kind of think on our feet, and it worked very well. And I think we also know that this is a continued effort, right, to work together going forward for heart care as well as stroke care.
When you're in a situation like that, you don't want to sit in a room by yourself wondering, am I progressing? Am I getting worse? Whatever. And there was somebody by my side the entire time.
The TNK had done a pretty good job on removing a lot of his initial symptoms. So his vision was getting back to normal. It was still a little bit blurry, but he had already had a significant improvement from onset. So we just continued that assessment every 15 minutes. He was a little scared, a little nervous. We did a lot of education with him to let him understand the medication he had gotten, the side effects he might experience, things to notify us about if we weren't in the room when he started to experience symptoms, to let us know immediately.
They did a real good job of describing to me, this is what we're gonna do. It's risky. Here's the bad side, here's the good side. Had they not informed us real well of the pros and cons of it, and that they actually let me and my wife make the decision, they didn't push it on us.
He was very fortunate, and I was so thankful to see how he responded to the treatment. He did have pretty much a full recovery from what I know.
It's nice to know I can come here and get as good, in my opinion, better treatment than going to the big hospitals here, there, and everywhere else. You're a lot closer to life-saving procedures if you need them right here at your hometown.
Shopping and running to a friend, chit-chatting with them, started to get the worst headache of my life. All of a sudden my vision started to get blurry, and then I couldn't make their face out. The only thing we could think of, something's got to be really wrong.
Really didn't honestly think it was stroke because he didn't fit all the other criteria like you typically would see, but just out of precaution because of his age. Something definitely was going on because he obviously, when you would evaluate that left side, his vision was really off.
Anytime there's a stroke alert, we take that very seriously because there's such a small window of time.
There are risk factors for stroke, and this man had none of them. No diabetes, no hypertension. I was concerned of two things. One, has he had a stroke? Or two, is this a symptom consistent with like a demyelinating disorder, like a new onset MS?
Dustin's biggest complaints were dizziness and loss of vision in one of his eyes.
And he didn't meet the parameters of like age, overweight, wasn't on blood thinners. He didn't have like those typical things that we think of for stroke.
I thought, he's so young, like hopefully this is not a real stroke, but you know, we do all the things anyways, just in case.
And in fact, when we got the MRI, rather surprisingly, he had had a stroke.
Yeah, me having a stroke was not what I thought was going to happen at 42 years old. The team was very professional, fast, doing all their tests and everything, very courteous.
They were brought over to CT and MRI, and we noticed they were within the 4-hour window of a certain treatment, which is called TNK or TPA. We were able to obtain the images necessary and to give them that treatment.
So we had done all of our protocols for stroke and for TNK, the clot buster, and he was our first patient. Everybody was excited, but also a little anxious.
It wasn't just about how professional I were, but they actually seemed to care more than just doing their job.
Once we decided to give him the TNK, the clot busting medication, within a few minutes, he said his vision started to improve.
By the following day, my vision was starting to come back.
Also, I mean, by calling 911, we can go ahead and prepare the hospital to be ready. If they know that it's a possible stroke, they can go ahead and call their stroke alert.
It means a lot that I was able to get that in the time that I did. It could have been a lot worse.
And we need to, keep in mind that there's no age boundary to strokes. It can happen to anybody.
And had just literally shook a pastor's hand, got in my vehicle to drive home. I went to shift my hands and I could not lift my arm. This is literally the hand I just shook the pastor's hand with. Not sure what had happened to me at that point, and I was trying to work my way through it. And even when I finally did call, I didn't call 911, I called Van. I recognized that I made a bad call and not making the call immediately.
He came into the emergency room complaining of dizziness. He said that the day before he was driving, he actually had weakness in his right arm. And I thought, that was kind of concerning. Kind of made me concerned that he was having a stroke. We work like a very well-oiled machine. We're a very cohesive unit. Me as the provider, I do the initial assessment, I do the exam, and our nursing staff usually are starting an IV. Our techs are doing an EKG at the same time.
I didn't know any hospital acted that fast. He gave me a lot of confidence.
The most I love about medicine are patients' stories. He stands out in my mind because this was a person, if I recall correctly, has gone like all over the world, following his beliefs and to preach God. Watching him do so well and have so much support, that's the best part of medicine.
This hospital is running unbelievably well. I saw from the inside out. I always had confidence in the leadership. Going through what I went through and seeing firsthand how well our community hospital rose up to meet my needs.
Certain patients may have, weakness, certain patients may have numbness, right? Everybody's going to be different. And ultimately, in addition to these things, you also have to look at the medical history, the age. Every minute that passes by, millions of brain cells in the brain and time lost that, it could be permanent disabilities.
The fact that he had such good early recovery made me think he's going to have good long-term recovery. But the truth is, I think the care here is incredible. The nursing care, I hear patients again and again say, we never get nursing care like this.
Even the night staff, they know you're sleeping good and they're coming in and they're just kind about it. They're gentle about it. I just think that's worthy of praise. It was an incredible experience and I'm very grateful.
I woke up and I couldn't talk. I went and found my friend and had him call the ambulance. I knew I was messed up, and I know I use a lot of drugs, so it was time.
When Mr. Taft came in, he was in a bit of distress. His blood pressures were through the roof. was having a real hard time making his speech be understood, and he had a very clear facial droop. Right away, we have to determine when those things started. If they present within that golden time period of 4.5 hours, then we have treatment options.
All I remember is waking up and seeing my mom and dad.
He had had his symptoms for several hours, but was still within a time period that there were treatment options, which means we needed to get EKGs, glucoses, and getting him to the CT scan, ideally in the first 10 minutes when they're here, to help us rule out bleeding inside the brain.
I think we're kind of, in some senses, the unsung hero. We're there and we're getting the scans done, but we're probably not going to see you face to face. Sometimes we do and sometimes we don't. Having dealt with stroke personally in my family, I know how important this role is to treatment and care for that patient.
He was pretty much unresponsive on the ventilator and couldn't move his right side at all. Was in the ICU, kind of in a pretty bad way.
We also have available to us as part of our stroke center a neurologist that's a phone call away. And so I was able to discuss the case in detail and get really specific goals for how to manage his blood pressure to make it safe for him.
The first couple of days were pretty awful.
Yeah.
Day 4 or something, I said, "Hey, Mr. Taft," like we usually do, and he said something like, "Hey." I'm like, "Mr. Taft?" And he said, "Hey." And he said a couple of words. And I ran out of the room and got the nurses. I'm like, "He's speaking to us. Do you remember that?"
They were all great. I don't get to talk that much. They were very flexible and understanding.
These resources mean that we're giving the top-notch care across the whole state to people in our community. If you have to make a commute to another facility that's further away, you're eating up the time that you have to get treated. Here, you don't have to make that hour trip to a bigger town to get started on the treatment that really matters.
I'm just lucky. Life goes on. I mess up, but I'm still me. Minus the drugs. But I'm happy I'm alive.
I was driving to work, and all of a sudden the 2-lane road became 4, and then thinking, what's going on here? Thinking it was just something that was going to pass right away. I knew I was near Toccoa, Georgia, and my eye doctor is there. He'll know what's wrong with me. Something's going on here. Something's wrong. He'll know. He came in the exam room and he said he wanted me to come to the ER here at Stevens County Hospital because he thought I might be having a stroke. I went in and I sat down. I was still in a state of shock because me having a stroke like my mother, that's the last thing I wanted to hear. And they were testing my vitals and doing everything in a matter of just minutes. So I was very impressed. And so the next day I spent the night, had a very restful night. Woke up a few times, as you have to, with your nurses. So after my MRI, she came in and explained to me about what a TIA was. It's the first kind of stroke that you can have, that I had no idea. That's the thing about strokes, you don't know. They'd had all the training, and that was clearly obvious. Here at Stevens County Hospital, they just, are I think, a trendsetter in this area of Georgia. I know I live here, and there are few places that are stroke certified that really know what they're doing. So they did.
Here at our hospital in Stevens County, we are a certified rural stroke center. We've worked really hard to get this designation. We've been able to really make an effect and help improve patient care. So we are ready for, unfortunately, some of the strokes that do come in, and hopefully we can treat you as best as possible.
I would say the experience in a whole picture was I came in broken. I was still broken when I left, but I had the confidence in knowing that everything was going to get back to normal, and it has. There was no doubt they cared. There was no doubt that I mattered, my wife mattered. It was just very, very well done. So I would say thank you.
Being able to care for a patient in their most vulnerable state where they're scared, they're anxious, they don't know what's going on, and being able to provide the treatment that they need to get better from those symptoms is honestly the best feeling you can have and one of the most rewarding feelings you can have. So it's amazing.
And when you did do this, when I said, "Any more use?" you said,
Yep, and I haven't used it no more.
You see somebody who's dang near close to dead, and you see him be able to walk out to a rehab. That's like the best gift we could ever get.
Yeah.
So that's the gift you gave us.
I'm hearing from patients, they are so happy that it's right in their local community. I think we felt the need was here to have full-time cardiology, both in the hospital and the emergency department and in the outpatient setting, and definitely we're hearing positive feedback from patients.
Thank you, mainly. I appreciate everything they've done.
I'm so grateful for the care I received here at Stevens County Hospital from the people that drove me in the wheelchair to get my tests, who gave me that wonderful dinner, who, Dr. K, who explained everything to me, and Dr. Reed, who knew what to do. So if you think that this can't happen to you, guess again. And if it does, and you're anywhere within this area or even close, or you could take a plane and get here, this is where you need to come.
From the bottom of my heart, thank you for the way they treated my wife. They were treating me, but at the same time, they involved her. They didn't push her to the side. She was extremely involved in decision making and very informed throughout the entire time. And that means everything to me.